First of all, let me just thank everybody for being here this evening. And today, the Missouri State Public Health Laboratory tested a second presumptive positive case for COVID-19. The case is a travel-related case. The patient is an individual in their 20s from Springfield who had recently traveled to Austria. The patient went to Cox Health, a Cox Health location away from the hospital. The Missouri State Public Health Laboratory has reported a presumptive positive result from COVID-19 and was forwarded the specimen to the Centers of Disease Control and Prevention for confirmation. The Missouri Department of Health and Senior Services and the Springfield Greene County Health Department are investigating the situation further and will continue to take all steps necessary to protect the health and safety of Missouri communities. As governor, I have no greater responsibility than to keep all Missourians healthy and safe. I know there is a growing concern across the state and the nation right now, but I want to assure you that we are taking all steps necessary to protect the people of this state. As of today, 73 people have been tested for COVID-19 in the state of Missouri. 71 people have tested negative. Only 2 people have tested positive. Both of these are travel-related cases. So far, there has been no community person-to-person transmission in Missouri. Currently, the Missouri State Public Health Lab has the capacity to test approximately 1,000 specimens. Missouri will also receive nearly $13 million in federal emergency funding to support response efforts. We are currently working on how to use the money to the most effectively protect Missourians. We are in daily communications with the Missouri Department of Health and Senior Services, our lead agency on this issue in Missouri. I've also been participating in regular briefing calls with the Vice President Pence and other governors for updates from the federal level. From the state and the local level, I have been holding regular briefing calls with mayors, county commissioners, and emergency personnel from across the state. We knew this was coming, and we are taking every precaution we can. We are actively taking steps to protect those under the state's care. As a precautionary measure, the Missouri Veterans Commission has restricted access to our veterans' homes across the state, and the Missouri Department of Corrections announced today that it is suspending visitors at all state correctional facilities. We also know that there will be people traveling and returning home to Missouri. We are aware of this, and we are prepared to handle these situations. Again, I want to assure you that we are taking all steps necessary to protect the health and safety of Missourians. We have an excellent healthcare system equipped with trained professionals, and I am confident that Missouri is well equipped to deal with the coronavirus. However, I want to emphasize that at the end of the day, we are all responsible for our own actions. Use common sense. Practice good hygiene. Wash your hands. Stay at home if you're sick. And if you are told to self-quarantine, it is very important to follow those instructions. At this time, we have not declared a state of emergency for Missouri. My administration will continue to evaluate the situation and all options to provide the resources that are needed will be on the table. And state government will continue to operate and provide services to our citizens. Please know that this situation changes daily. We will continue to be proactive, and we will continue to work closely with the federal, the state and the local health officials and emergency personnel and provide you with the most accurate, up-to-date information. I will now turn this over to Mayor McClure of Springfield. Ken?
Governor, thank you, and thank you for your leadership and for that of Dr. Williams and the Department of Health and Senior Services. I'm Ken McClure, Mayor of the City of Springfield, and we are here today because our community believes in transparency. As the Governor noted late this afternoon, we were notified that we have a case of the COVID-19. Health officials immediately took action. We have the right experts at the table to help us chart our course forward. Our community, under the leadership of the Springfield Greene County Health Department, has been bold in preparing for this moment, and I am confident that the department, along with our agencies and partners, will be able to effectively deal with this situation. We have well-known experts who are up to the challenge. The coronavirus task force formed last week has made significant progress in planning and preparation. Springfield community and Greene County has a strong legacy of responding to disruptive issues and to take those lessons learned with us to do even better in the future. So I have every confidence in how Springfield will face this challenge. And at this time, let me ask our Director of the Springfield Greene County Health Department, Clay Goddard, to come forward.
Thank you, Mayor McClure. Shortly after 3 o'clock today, I received a call from the Department of Health and Senior Services with the notification that I knew would eventually come, that we had our first presumptive positive COVID-19 case. As a part of the regular practice of disease investigation, the Health Department will notify people who may have had contact with the patient. Additionally, we're working with the Centers for Disease Control and Prevention and the Missouri Department of Health and Senior Services to determine where the patient traveled after coming to the United States and any close contacts of that individual who were possibly exposed. If so, health officials will provide guidance to those individuals and monitor them closely for the development of symptoms. I am grateful that I'm in a community that has very strong cross-sectoral partnerships. We also have incredible support from local elected officials and from our state elected officials and from our partners at Department of Health and Senior Services. Finally, I want to specifically thank our partners who are members of the local public health system. Cox, Mercy, and Jordan Valley have never hesitated to step forward and to provide us with the help that we need. As we move forward, we're going to work with great diligence and purpose in making the bold steps that are going to be required to curb this illness in Springfield, Missouri. Thank you. And I'd like to recognize Dr. Robin Trotman from Cox Health. He does infectious disease work there, and he'll provide some brief comments.
Thanks, Clay. So we'll talk about this particular patient in sort of a vague swath. We have set up our incident command structure in the system such that the Cox Health Systems has a incident command strategy of preparedness and education for our health staff. And what we found is that our first patient notified one of our clinics, a non-hospital based clinic. The clinic was prepared, the clinic was empty, the patient presented to an empty waiting room, was masked immediately, which is consistent with our strategy from a public health standpoint, was brought to a private room, had the appropriate testing performed. The patient had displayed symptoms consistent with COVID-19 and had traveled to a high-risk area. So our education that had been disseminated prior to arrival of this patient was timely. The patient was tested, sent home, and has since been in quarantine. And the patient's most likely expected to make a uneventful recovery. This particular patient had been generous enough to call our office, call the office of this particular clinic, and notify folks. And so that was really the public health key. The patient was masked on presentation and has been under a controlled environment up until this point. So that's all.
Okay, we'll open it up for a few questions. Folks have had contact with very many people before being diagnosed, and how has that been addressed?
We're in the beginning of our epidemiological investigation. We won't talk specifics about that, but I can tell you that as we find contacts, we will take all appropriate measures to isolate and quarantine anyone that requires those movements or those actions. We have a wonderful team of very skilled disease control specialists, and we are taking this very seriously, and the patient is very compliant. So I'm very comfortable that we will have all of the action and information that we need to move forward.
Was this one of the 3 people that you referenced earlier today, one of the pending tests that you had out?
It was a pending test.
Are they related to any of the other people who've been tested?
I don't think that I have any information that would lead me to be able to answer that question.
Can you explain what a presumptive positive means? I think people would like to know the difference between that and positive.
Yeah, thank you so much. When we do the test, it comes back positive, and we call that presumptive because the CDC has to confirm it, even though it's done in our state lab. And we send that off, and it takes about 4 or 5 days. But we don't wait for that because to date in the United States, those tests have been confirmed. So we don't wait to start the epidemiological investigation that Clay was talking about. That will start immediately.
Now that we have a confirmed case in Springfield, will we have more access to more tests? I heard today we only have 5.
Yeah, thank you very much for that question. So right now, as the governor said, in our state lab, we have the capacity to do 1,000 tests at this moment, and we expect more to come tomorrow from the CDC. And for our state lab, we use pretty stringent criteria. Commercial labs, there were just LabCorp now doing that. And I talked to the director of LabCorp yesterday, the national director, and they plan to push out more now. But I just want to say that the governor really stresses communication. He thinks that in this kind of situations, being a former sheriff, that anytime you have an emergency like this, and I have to tell you, at 8 o'clock this morning, your health department called me and said we need the capacity to do more testing. And at 1 o'clock, we were meeting in the governor's office, where I was when we got the results of this positive test, about that very thing. So I can't thank the health department here. It is state of the art. The care you get in this community at the hospitals is state of the art. I'm thankful the patient's doing well. That's always our North Star, how that patient's doing, and we're certainly thankful for that, and would commend that patient for doing all the right things, and the clinicians who took care of that patient, and the health department that got the test to us, and we turned it around quickly. We put a lot of preparation in this, and for the patient's sake and the community's sake, we're just very thankful it went as we would hoped it would.
Does this patient go to a local college here, and are they from the area, or are they just a student here?
We would not provide those details as a part of an epidemiological investigation. We will notify all parties that would have concerns as part of that investigation and take appropriate public action and notifications if necessary.
If that first test came back positive today at 1, should the public have known earlier in the day that this was a positive to reduce the risk of it spreading?
I was notified shortly after 3. We turned it around by 6. I think that by definition is being transparent.
Clay, the universities have extended their spring breaks. Now that there has been a presumptive positive in the community, is the health department going to recommend extending that period of time?
The mayor and I were in a meeting this morning with all of the presidents of local colleges. I know that that's a topic of conversation. We can certainly participate in those conversations, but we will work with the guidance of the presidents of those universities and provide them technical feedback.
Mr. Governor, do you foresee any need for executive or legislative action since this is the second presumptive positive in the state so far?
Yeah, I think we have everything on the table right now, what we might be able to use. But right now, my goal as governor of the state of Missouri is to support the local entities that are here. And I think that's a priority for me, to make sure that they have what they need. If that local authorities would ever get overwhelmed or feel like that they had to have support, then that's what we're here for. And we would do that. But right now, you've got a mayor here, you got a health department, you got medical facilities here, second to none right here in Springfield. So, I believe they're well capable of handling this, but we're here to help them. And I think the important thing is with the federal government, I think what everybody needs to realize a little bit, everybody's trying to get as much resources out there as you can. And it's not a question so much financially as the money. It's just a matter of companies and industry being able to have that output of the supplies we need. But I think everybody's working around the clock trying to make that happen. And in time, Missouri will get their fair share of those things that are out there. But right now, I think for today, we feel comfortable that we're prepared.
We'll have time for one more question.
How long has this patient been back in the country since returning from hospital?
I don't know that I have the answer to that question, and if I did, I probably wouldn't share it as part of the epidemiological investigation. But once again, we will be making contact with anyone at risk from this patient, and if there is risk to the general public, we will make public announcements as such.
Okay, thank you very much.
Thanks for raising that.